Welcome back to the Art and Yoga and Wellness Podcast. I am your host, Kira Whitaker. So in today's video, I'm going to be talking about this hot word that I've heard. I hear it everywhere. It's whimsical, it's mystical, it's alluring. It's also kind of not super clear what it is, and it's embodiment. So if you've heard people talking about embodiment in the health and wellness space, I'm going to clear it up today. I'm going to explain it. I'm going to go over how people typically find themselves in a true embodiment stage in their life. I'm also going to give you some tips and tricks to maybe get there yourself. So head on over to today's video and we're going to talk about embodiment. Welcome back to the Art and Yoga and Wellness Podcast. I'm your host, Kira Whitaker. So today, I'm so excited to be talking about one of my, just main loves. One of the main loves of my life. And I'm not about to talk about my horses or my dog or my kid. None of that. No. It's yoga. In last week's episode, I had talked about how I had been home for a few weeks just because of just stomach bugs and sickness that had decided to come into our home and stay there for a minute. And while I was home, I had the opportunity, because I was home and had some extra time, to do some continuing education. I had signed up, I think probably last month maybe, for a yoga conference out of New York. And it was the Neuroscience of yoga. And it was with some of the top yoga therapists, psychologists, researchers in the United States. Some were even outside of the United States. And it was such a great opportunity for me to be able to dive into a topic that I love so much, the field that I'm in, but it's also such a emerging area of healthcare and science that there is rapid research being done, which also can be really time consuming keeping up with all the different publications and research. And so I was able to do that, and it was really great. And so it prompted me to come up with this week's podcast topic, because one of the one of the conferences that I did was yoga therapy, yoga for eating disorders, body dysmorphia, body image disorders, and so forth. And so through that, obviously, I took notes, I reflected, I absorbed. And any time I do any sort of continuing education, I always try to pick things that I think would be, one, filling gaps of knowledge that I don't have, two, things that would complement my practice with my clients, and then also just things that interest me, because I think there needs to be a certain level of interest there for me to retain the knowledge and to stay connected to it. And so since I have a personal history with body dysmorphia and eating disorders, and I work with people in their bodies, it seemed like a great one to click on. So I did, and it was so informative. And I'm also just at a point in my own body and healing journey to where I was able to really dive in through a clinician's brain instead of somebody solely that has recovered from an eating disorder, which was a really, really nice headspace to be able to be in. So with that, what we're going to talk about today is embodiment. And embodiment is a real hot word that I hear and see a lot. And I think it's one of those words that's just kind of, again, like kind of trendy. I think it's kind of alluring. It sounds very mystical and transcendent and cool. And so it's being used a lot, but I don't know if people really understand what it necessarily means. It's something that I reference with clients, both health coaching clients and yoga therapy clients, to be honest, because a lot of my health coaching clients that I work with, they're wanting to feel better in their body. They're struggling with stress management, maybe sleep, maybe weight gain, maybe all of the above. And so we definitely address those issues in health coaching as well. Yoga therapy is more for me because I specialize in stress management and pain management and mobility issues. Obviously, embodiment comes up a lot in the studio when I'm working with clients. And so that's something that I wanted to explain, go over, and then also give you some prompts to add an embodiment practice into whatever you're doing, whether that be yoga, meditation, maybe it's just functional movement. Maybe you go to the gym and before or after your workouts, you lay down on an exercise mat and you cool down and you stretch a little bit. Embodiment exercises and mindful movement can be added in there as well. It doesn't have to be necessarily categorized. I'm doing a half air quote with one of my hands if you're not watching on YouTube. Like an awkward, I just did the weirdest like little T-Rex arm and tried to do an air quote. I don't even remember what I was saying at this point. I just went off script. So I'll just forget whatever I was talking about. Okay. So as I've mentioned many of times, I'm an internationally certified yoga therapist. That is the main hat that I wear. I'm also a nationally board certified health coach. And so I also do health coaching with some of my clients. And where the health coaching is a bit different is I focus more on behavior change, motivational interviewing. How can we get people to reframe their habits and build new ones? How can we get people to build tools to where they can take action and maintain habits on their own and live a healthier life and more fulfilled life? So some of that, overlaps with yoga therapy, but we're going to specifically talk about yoga therapy today. So there are yoga teachers, which I'm also, I guess, a yoga teacher. I was a yoga teacher before I was a yoga therapist. But to give you a little bit of clarification on just what a yoga therapist is, if you're not sure. So a yoga therapist, typically, we have a minimum of like an 800-hour teacher training on top of your yoga teacher training. So you have to be a yoga teacher, so a certified yoga teacher, registered yoga teacher before you can become a yoga therapy student. And specifically what we're trained in is yoga philosophy, anatomy and physiology, psychology, biomedicine, pathophysiology, and some programs differ on what they emphasize more, especially if they're more of a specialty program. And conditions that yoga therapists often address are neurological conditions. So anywhere from brain injury to stroke. I've seen stroke patients before for yoga therapy. Chronic pain, low back pain, arthritis. That's my main area of focus is chronic pain and mobility issues, mental health, anxiety, depression, insomnia, illness support. There's a lot of yoga therapists that work in palliative care with cancer patients, diabetes, heart disease. So it really can vary pretty drastically. But because our training is so extensive and has so much Western medical focus in it, a lot of yoga therapists are considered part of the healthcare team. I was lucky that I came in and had a nursing background, so I kind of already had studied all of that stuff. So that was just to kind of paint a picture of what a yoga therapist is. So I see so many clients that are struggling with pain, discomfort in their body, injuries that are no longer acute. So they're no longer, healing. They're healed up. They're back to normal-ish, but there's maybe difference in their gait. Maybe they still have aches, complaints, concerns. Maybe they sustained a sports injury, and there's just still some lingering mobility issues there. And what happens when I see these clients is multiple things, but some things that come to mind are they start to not trust their body anymore. There can be this disconnect in the brain and body. And instead of the two coexisting together, so instead of this, mind, body, spirit trifecta, there's my mind in my body, and my brain is trying to get my physical body to submit and move and function and operate the way I need it to, and it doesn't anymore. So there can be a resentment for the body. There can be that lack of trust because the brain and the mind can almost perceive the body as unpredictable because it doesn't perform and move and act in the ways that it used to. And then there can also become kind of almost like awkward and weird mobility patterns that people will adopt after seasons of chronic pain or injury. There can also be really, really, I guess I could say, different and challenging daily habits or changes in daily habits and routines secondary to injuries and chronic pain. And then that can take a toll on people's mental health. If somebody's used to going and playing pickleball 3 days a week with their friends, and that's their community, and that's their social interaction, and that's where they feel seen and heard by their peers and their friends, and that is no longer an option for them, that can have a pretty big effect on somebody's mental health. So there's so many different contributing factors and things that happen when people are not feeling at home in their bodies anymore for whatever length of time that might be. And that's what I see the most in my studio. I definitely have seen clients that have body dysmorphia. I've definitely seen clients over the years that have been in treatment for eating disorders. That's not something I see a ton of, again, because I don't specialize in it, but it is something that I've seen clients in. And so here comes in this word of embodiment, right? And so what and how can I get to this place of embodiment, of living wholeheartedly in my mind, body, and spirit at the same time? What are the typical kind of stages and build up to that? And then what is a practical application for that? Okay. So one thing that comes to mind first is we first are often in this stage of self-objectification. And what I mean by that is seeing the body as an object, okay? Seeing the body as almost valued and assessed by others because the brain and the body are so disconnected from each other. And when I say the body is an object, what that could look like is my body is only worthy if it's a certain size. My body is only worthy and important and capable if it's muscular and strong. My body is only capable and important and worthy if it can do A, B, and C. And if it can't, then it's not useful. It's not worthy of affirming. It's not worthy of appreciating. It's not worthy of caring for. And so there's this objectification, this self-objectification kind of phase or stage or season that people can be in. And then let's say we start to move, though, in a direction of healing and in a direction of living in our brain and our body at the same time. So what would it look like? How would we know if we're slowly starting to move out of the self-objectification phase? And what that might look like is our body as a resource. So not so much of an object, but a resource, something that I can pull from. That could look like my body is a resource for my self-regulation. My body is a resource for well-being. My body is a friend to me. My body shows up. My body has done really hard things and gotten through it. My body is strong. So noticing and being able to affirm those things that the body does well and that it's able to do. Okay. So body is a resource. So meaning I'm able to pull things from my body. My body is able to show up for me in these ways. Okay. So then after we're in that season for a while, and after we sit with that, and after we start to not only repeat that to ourselves and almost make that a mantra, we might start to believe it. So once we're in this stage of believing that, then we might be able to move into this area of like full embodiment. And what that could look like is saying things or believing things such as, my body is essential to who I am, or I live in my body and I'm from my body. Every bit of growth, every bit of life that I have is because I've done it in this body. So looking past what the body is seen as, even what the body can do for me, and being in this space of, I can do nothing without this body. Good, bad, ugly, nothing can be had or done for me if I'm not in this body. That's embodiment. That's living wholly and fully in your mind, in your body, and your spirit, and understanding that you can't be whole without those together. You can't be whole and live inside your brain all day and be completely disconnected from your body. You also cannot be whole and live only in your body and just use your body and go lift heavy and go run and just be in your body, in your body, in your body, and then completely disconnected and numbing from your thoughts and your feelings. Okay. I think of it as I am a mind, body, spirit. And whatever this human experience is, whatever this side of eternity is for me, I can't do it and I can't experience it without my human flesh. And I can't experience my human flesh, this human body can't function without the feelings. And I'm also not an animal. There's a spirit inside of me. And so all three of those things, they can't function. They can't live without the other. And they also don't have a purpose without the other. The thing that gives me, as me, Kira, the thing that gives me purpose is being able to live in my brain, in my body, in my spirit at the same time. That's embodiment. Okay. And so if you're like, well, Kira, how do you even put embodiment into practice? Well, there's things that you can, almost conversations you can have with yourself. Some of the things that I said is just acknowledging or affirming or saying to yourself, I live in my body. I can't live in this life. I can't go through this life without being in this body, in this mind, in this brain. My body is essential to who I am. I am this body. This body is not just something I'm forced to be in, that's against me, that's not for me, that just has, all of these ailments and all of these problems. This body is me. I am this body. Okay. And then if we're talking about the real implementation of it, how can I really, really kind of bring it home? You could add in some embodiment exercises. The way I like to do embodiment exercises with my clients are a lot of grounding exercises. So getting people in their brain and body, and then allowing for them to actively sit in that. A lot of times people are fine to like notice their body, but then they want to get out as soon as possible. It's bored. I want to move more. I need to fidget. I need to do something. This isn't exciting enough. But really being able to sit inside of your body and feel grounded in your body and just be okay with being in that body and that brain, that's a really, really difficult exercise for a lot of people, myself included. And so what that can look like, let's say I was right now on a Zoom call with a client, a yoga therapy client. I would say and probably prompt them and invite them to sitting comfortably in your chair. Slowly take both feet flat on the floor. So uncross your legs if your legs are crossed. And then whenever you feel ready, just notice your feet on the floor. Notice all 10 toes. Notice the balls of the feet. Notice the heels. Notice the weight of the feet. Notice the pressure of the feet up against the floor. And then notice the breath. And just going back between a conscious breath and the sensation of the feet feeling heavy on the floor. And then moving up the body and noticing the sit bones, the weight of the pelvis in your chair, and then going back to the breath. And then going back and forth between the breath and the seat. And staying with that. And so you can do that exercise with all points of contact on the body. If I had a client who was laying flat on a yoga mat, I would cue them back of the skull, the upper back, the low back and pelvis, the heels, anything touching the floor. I would invite them to ground the body down. So relax, exhale, allow for the body to feel heavy, and then stay in the body. And when I say stay in the body, noticing the physicality of the body, going back between the breath and the body. The breath helps you stay connected to your thoughts and your mindset. It helps your brain not wander too much. And then you go back, physical body, brain, physical body, brain. So you're existing in that space at the same time. And it's challenging. If you're like, I can lay on the floor, Kira, or I can sit in my chair. I know you can, but can you acknowledge all points of contact in your body? And can it not be about how it feels? Can it not be about weight? Can it not be about can it just be the sheer acknowledgement that you live in this body and it is enough and it is good and it is able and it is well? And then can you stay inside your brain? And can that be okay? Can you stay in your breathing? So that's the challenge. That's the call. That's the assignment is I live in this body and this brain, but can I steward it? And can I do it in a way that is kind and is acknowledging and affirming? And that's one of the biggest challenges I see with people is they want to fix it. They want their body to move the way they want it to move. They want to be able to do what they used to be able to do. And they want it quick and they want it clean and they want it expedited. And it's typically a lot trickier than that. And there's a lot that goes along with it. And because there's those emotional and challenging mindset components with changes of the body, there needs to be that work with it, because if we're just trying to shove the body in shapes and get the body to physically submit to us, we're going to encounter a lot of friction. And so the embodiment piece of it, I think, is imperative. I think it's crucial. I think it's one of the most beautiful and impactful and important pieces of the art of yoga therapy and why yoga therapy can be such a great complementary healing modality once somebody's done with like physical therapy, and there's still work to be done. I just, obviously I can't say enough about it because I've been doing it for going on 12 years now full time. And it's like this tried and true formula. Like, I don't know anybody who's continued to show up for yoga therapy sessions with me that has not seen improvement. Now, if people show up twice and then don't come back and say it didn't work, then obviously that was their experience and it didn't work, but it was because they came twice. But the people that I see that keep coming back, that implement the work that I show them at home, their kind of yoga prescription for at home, and they stick with it, most of them not only are able to move better in their body, feel better in their body, feel more autonomy and feel empowered to know how to care for their bodies, but the relationship that they have towards their bodies and the mindset that they have when speaking to and about and living in their bodies also drastically changes, which is so important. And it's why I continue to do what I do, and will hopefully continue to do it for like 30 more years if I have any say in this. So I hope that today was informative. I hope that it was practical. I hope it gave you some good takeaways. I hope it clarified that hot kind of buzzword that I've seen a lot of, embodiment. I hope that gave an actual reference of it and made it a little bit more clear, or at least in kind of my field and my line of work. And as always, I'm so glad that you joined me. I know there's so many different podcasts that you could listen to and YouTube channels and all the different things. And so anytime one person listens to the podcast, it really does mean a whole lot, because I'm just a random girl in Middle Tennessee, gabbing about all the things that she's interested in and passionate about. So thank you for listening. And until next time, I'll catch you guys later. Bye.